Alright, guys, welcome back for some more Project Hospital. Thank you very much, Seraph Blades. It is the best way to hype up for the work week ahead. Okay. This is what not to do when you go to work. But since you mention it, let's have a look at operating theatre. I've got someone on the table. Patricia Harris, a manager from Quick Snap Care. She's got peritonitis. What do they do for peritonitis? A laparotomy and a washout. But yes, we are back to where we were. The very hard event that we're trying to finish successfully. Finish 5 events in a row. Oh, I did 3. Did I do 3 last week already? Oh, I thought I hadn't started it yet. Okay, then we only have 2 to go. Let's do it. Let's just check the wards to make sure that there's space for whatever might come in. There's only 2 beds in emergency. Oh, what's going on with these people? Purpura and fatigue. They haven't had a blood test yet. Uh-oh, this is a problem. Okay, let me have a look at this. Temperature. That was done. Oral cavity inspection, neck palpation. Sure. Yep, that's done. Physical exam, interview, neck palpation, interview. So it's just the serologic. Oh, maybe an x-ray. Yep, that's already ordered. Okay. Oh, maybe I've done this already. Urine testing. I think I did do this. Because normally the doctors don't do like a urine test or an x-ray. So I must have been through this patient already. Why has it not happened yet then? Whoa, this guy hasn't had much investigation done. He's had lots of investigation done, just not what I need. He needs a culture. See, they don't do their stuff. To differentiate amoebiasis, you need to do a culture. Oh, never mind, they did do it, so it's not amoebiasis. Thorax percussion, done. CT. X-ray chest. MRI. Let's start with X-ray chest. CBC microbial. Okay, so it's not that. Chubby Kim, hello, how are you? Thank you very much for joining me. This one needs MRI. I'm good, thanks. So, sorry, my streams are a little bit out of whack. I'm meant to do them at 11:30 p.m. Australian Eastern Standard Time, but I am also working PM shift these days, and when I get home from my afternoon shift, I'm too tired. It would be a sleep stream. I don't know if anyone wants to see that. Certainly not what everyone comes here for. Oh, ECG? Oh, can't do it in this department. Oh, you can do heart monitoring? Oh, since when could we do heart monitor? Oh yeah, because they've got a monitor on the wall. I didn't realize I could do that in just the normal acute emergency. Angio. So he needs CT enterography, and angio. Oh, that's the ophthalmoscopy. What's the chances it's going to be giant cell arteritis? Pretty low. Biopsy, UA. I did a lot of UAs at work yesterday, in case anyone is wondering. How's your work been? Average day yesterday, very busy the day before that. I've only been working once every 6 months for the last 2 years. So in the last month, I've been working every second week. I did three shifts a couple of weeks ago. This week I'm doing 4 shifts. I don't know how I don't know how I used to do 5 shifts in a row. 4 shifts is a really long time. But the day before yesterday, the educator asked me to go and look at someone, assess someone in resus, and I was like, I'm casual. I've only just started back here. I can't do stuff like that. She was like, yeah, you'll be fine. You were a numb for 2 years. So I did. And then that thing that I had to assess ended up not happening. But they had so many patients in resus, I couldn't get out. They're like, oh, we need more staff. And I was the nurse looking after the waiting room. So I was basically doing obs on people, and that can be done by someone else in between times. So I just was told to stay there and help. All right, that's about all we can do for that guy right now. Once his x-ray, if his x-ray doesn't show anything, then we can move on to doing a CT or an MRI on him. Well, this one's got everything ordered. And that one's the one that I just did. All right, let's check out cardiology. Cardiology is good. CCU. CCU is good. Flail chest. Oh yeah, because we don't have cardiothoracics in this game. Oh, okay, pneumonia. Why are they doing all of this stuff, I wonder? Okay, Patricia Anderson needs a physical exam for an ACL injury. Got sinusitis, good. Well done, Carol. Thanks for not over investigating that patient. Oh. Oi! I wasn't even trying to do one. What was that? The objective for insurance companies being completed to treat 80 patients per day. Woo! $50,000. Antimyocotics. See, this is why you got to do ward rounding, because they don't do their job. This patient did not have all the stuff she needed. Beta blockers, okay. Oh, for a tremor. Okay. I totally agree with that treatment. CIPD. Oh, she needs rice. 200 bonus points in chat if anyone can tell me what rice stands for. Too easy, I know. Holy cow. Hello, Kip the Dish Pig. Thank you very much for joining me. How are you going? Monday, start of the work week. Look at me. I'm up early, ready to start my work week in the hospital on Project Hospital. Oh, Seraph Blade's nice one. What will you spend the grant on? Probably a new ward. Using the money I already have plus that, and when I get full. Sorry, there's a lot of patients in the hospital right now, but we will start a new event very soon. I just want to make sure that there's space, which I didn't actually do. There's plenty of ICU space. There's plenty of orthopedic space. There's a bit of neurology space. There's a lot of, this is internal medicine. There's a lot of internal medicine. Cardiology is looking a bit sketchy. Surgical is, oh no, it's not, because we've got this cardiology here as well. So this cardiology is fine. And then we've got some more internal medicine up here. Then we've got, wow, we've got so much ortho space. And then down here is the rest of our surgical ward. Oh, and this one. What is this ward? Internal medicine? Or is it more surgical? Oh, it's more surgical. Holy cow. I made so many beds. I think I went overboard with the amount of beds. So you just got to come through and make sure, because the doctors don't select the actual treatment that they need, and then there's other stuff that you can just add on. Oh, this person's waiting for abdominal surgery. Does that mean surgical is a problem? I probably need a new surgical team. Also, Chubby Kim said your body clock has to change many times this week. You have no issues with the sleep. Oh yeah, I'm almost done with my week. Just today and tomorrow left. 2 more shifts. Keep the dipshit dropping a lurk. Busy at work this morning. Okie dokie. Enjoy. Don't work too hard. Oh, Seraph Blade's got the 200 bonus points. Well done. You got rest, ice, compression, elevation. If you ever injure your limb and it's not a broken bone, all you have to do is rest, ice, compression, elevation. Just need to use my very advanced documentation for where your 200 bonus points are stored. So at the moment on the bonus points, we've got Kip the Dish Pig on 400 bonus points, Bum Fluff on 400 bonus points, and Seraph Blades has entered the fray with 400 bonus points. You guys can spend those anytime you like. Maybe I should have a web page or something where you can go and check how many bonus points you've got. Okay, Charles Gonzalez is collapsing. Where is he? What is he doing? Oh, he's an ED patient. Yeah, because I think I need more ED staff, don't I? This is the problem. This is why nothing's getting done for these people. Do I need more nurses or more doctors? I think I need more doctors. Look, I've only got this tiny little doctor's room. What if I put a desk on this side of the room and just keep squeezing them in? Good luck getting in this room. Gonna interrupt all the people. Alright, so I gotta add the staff too. Just a low... Oh, it's not attending? Okay, I don't have any interns available, but we've got an attending. Lisa Jones, long wait for examination. Okay, I can't help you with that. Alright, I think I'm ready to go. I added a new emergency doctor, so that should help. Let's do this. What are we going to do, guys? Are we going to do an accident, an epidemic, or a natural disaster? Please, well, let's do a poll for however many people are still here. I should have done it here. I should have done it while Kip the Dish Pig was still here. All right, go. So the poll is in. Ooh. Thank you, AMD, for trying to give me an overlay. Michael Lee's had an interview. Oh, and his interview has shown up PCF. He needs some eye drops. There you go. Well done, Michael Lee. Where are you? Why can't I discharge him? Oh, he's got a high fever. He probably needs to be admitted then, I guess. Always x-ray the limb, because sometimes the doctors are not able to tell whether it's broken or not. Oh yeah, okay. So give him antibiotics, then he can go home. I mean, if he's got a high fever, he sounds like he's septic, he probably should be admitted for antibiotics, but The game lets me discharge him. Infectious mononucleosis. Or thrombocytopenia. Okay. Did it? Where is it? Is it ended? How do I tell how long a poll has got to go? Oh, there, it gives it a little trophy. Natural disaster is the winner. Let's do it. Breaking news, crash on the stock exchange. That's not a natural disaster. Responders are reporting an unusually high amount of suicide attempts resulting in brain and heart problems. Alrighty then, how many patients do we have? Wow, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. We've got to treat 11 patients. Do they walk in? Do we get walk-ins for this? Why is the ambulances not going? I've got 4 ambulances. And there is 6, 8, oh 9. 9 of the patients need to come by ambulance. What sort of imaging do you need for this? A X-ray head. What did that ambulance just drop off? Pre-emergency. Yep, they want to do an X-ray. Good. Brooke Moore. She's got a foot contusion, so she can have some numbing ointment. Come on, let's pump out these patients. Oh, she's having an angio? Okay. Hopefully that finds something. Frank Adams, he needs an X-ray head before I commit to the diagnosis. He might actually need a CT of the brain. Did he have any loss of consciousness? Maybe I should do a neurological exam as well. Just to make sure. Oh, here's one of the disaster patients. She's got a headache. Whoa, Dr. Bumfluff. You're on it. She's got hypertensive renal disease? What? There they go. Now they're going off to do... All the ambulances are going off. Primary peritonitis. And she's having respiratory failure. Interesting. HHD with heart failure? Okay. Cardiomegaly. Needs diuretics. Oh, keeping ahead of these patients. Wait, what is this MRI got? Oh, that's the chylothorax guy. Nothing came out of that MRI. Okay, we can have some analgesia. You might see me avoiding the cough suppressants there. Oh, diffuse axonal injury. A diffuse axonal injury is one of the most common head traumas. It occurs when the brain shifts too quickly inside the skull, like in a car crash. Your brain. So your seatbelt holds you in place. Your head, when your head stops or moves, your brain is still floating inside, so it still hits the front of your skull and the back of your skull. So you can get a diffuse axonal injury from stopping suddenly. There you go. Did anyone ask for that little tidbit? Wait, not sleeping drugs. Don't give sleeping drugs to someone with a head injury. Are you insane? You won't be able to assess their neurological function very well if you give them sleeping drugs for their, what has he got? Sleeping problems. Sorry, dude, you're just going to have to deal with sleeping problems. Alright, he's got a mandibular fracture. He needs an orthopedic admission. And then he can have some NSAIDs as well. NSAIDs. I injected someone with NSAIDs yesterday. So a few years ago, before I'd left my big hospital to go to the small hospital, I had never heard of this non-steroidal that you can do as an injection. But then I went to the small hospital, they use it all the time there, and then I actually had to give it to someone yesterday back in my big hospital, Aldwork. So that was interesting. It must be a new emerging trend. Scheduled procedures have finished. Last was blood draw. Okay, good. Do the treatment, don't do the procedures. She needs corticosteroids. Probably do the corticosteroids first, actually, and then do the other stuff. Oh, is this her? Okay. Yeah, do the corticosteroids. How long has she been here? Who is this patient? I don't know. I think I heard another ambulance though. Did I miss one? Oh no, they haven't come in yet. What happened to the diffuse axonal injury? Here's someone with a concussion. Everyone know what a concussion is? Should we read it for you? Concussion is a mild traumatic brain injury resulting in a temporary altered mental state and or loss of function. You can tell by someone having repetitive questioning and maybe a loss of consciousness. And if there was maybe a loss of consciousness, I would like to do a CT brain, please. Because I'm going to get caught out later when she's got a bleed and when he's got a bleed and no one picked it up. How old is he? 62? 100% he needs a CT brain. Because as you get older, your brain shrinks inside your skull, and so then there's more room for movement, and then you've got these little blood vessels that run on the inside of your skull and then go to your brain. And then when you have a diffuse axonal injury and your brain moves and you've got more space in your brain because your brain is smaller, then you can get little tears in the blood vessels up in that are going to your brain, and then but you don't get actual neurological symptoms straight away because you've got more space in there, so there's more space for it to bleed into the cavity of your brain. So you have to do a CT scan on older people to make sure that there's no bleed, because you might not find out until later that there's a bleed from symptoms. Wow, I'm giving too much extrapolation today. Just play the game. Just play the game, Josh. Stop talking about it. How do we differentiate exocrine? Stool sample? Holy cow, this patient's going to be in trouble. Oh, here's the next ambulance. If I can go, Sarah Garcia, a 48-year-old factory worker. She's got a cerebral contusion. So, I mean, I would like to do a neurological test on her. NSAIDs, okay. Why was NSAIDs already selected before she even hit the bed? Oh no, this guy's waiting for the receptionist. The triage nurse, where'd she go? To the toilet? Or change shift? Sorry, I missed all the chat. Shelby Kim said, Dr. and Chef Bumfluff? Yep. He is a man of many talents, says Seraph Blades. Seraph Blades said, still trying to figure out how the crash in the stock market is a natural disaster. Yeah, thanks. What's their name? Oh, how come I don't know the name of the devs here? I do know it. Oxymoron. Yep. Thanks, Oxymoron. That one didn't really work. And then Seraph Blade says, no, it's great to hear the explanations. Okay, I'll keep, what is it, word dumping. Oh, look at this, man. We've already done 5. We've still got 15 minutes to go. The only thing slowing us down is the ambulances. This guy needs nitrates. Oh, is he the one that just arrived? Oh my goodness. More ambulance faster. Why is there still 3 here? They should be out at the scene. I have so many patients out there. Okay, now we've got Charles Gonzalez. He's collapsing. Oh, this is his second. Oh yeah, that's the one that I said he's in trouble because it's going to take a long time to get this resulted. I wonder if you could choose something. Abdominal pain, vitamin deficiency? No, because you can't tell. I wonder if you could treat exocrine. No, you couldn't give PERT to someone that doesn't necessarily have it. I wonder if I could take the load off though by sending him to surgical. Let's do that. Once he's stabilized. Like he might get faster treatment in the ward. Who's Robert Jones? Why is he collapsing? Oh dear. Code blue. Oh, we could fail. He needs a cardiology intervention. I think I need... Do I need more nurses? Wow, why is there 2 doctors in here? I've never seen 2 doctors in here before. 2 doctors and a nurse. I think the nurse is not actually meant to be there. I want to get him to cardiology. There's 2 nurses stuck in emergency. This is not good. That means there's only 1 nurse who's actually doing work in emergency. CSF would be CT before CSF. Okay, audiometry, then CT. For Michael Taylor. What happened to the other person that I needed to check on? Okay, one of the nurses started moving. Good. She wasn't fully stuck. Where was the other patient that I was like, oh, he might need a CT or an MRI. He might need an MRI later. Who was that? I'm gonna check the wards. Hang on a sec. Myocardial infarction. Okay, get her to cardiology. Which patient? Robert Jones? No. Robert Jones has already got a myocardial infarction. So we don't really need to do... I mean, he could do with an echo, I guess. And a heart monitoring. Oh, he doesn't need heart monitoring because they've already found palpitations. Maybe an angio? Just to get the unknown symptoms. Bed required for examination. Blood pressure is occupied by your staff. What? Charles, yeah, that was the exocrine pancreatic insufficiency. Nothing could be done, sorry. Your staff did the best they could. Objective complete! Treat 90 patients per day. Next one interns available for hire will be a great candidate. Awesome. Okay, let's hire a night shift emergency doctor. No. Do I have an intern? Fellow specialist resident? How do I get an intern? Oh no, this is one of the disaster patients and she's collapsing. Yeah, because she needs to go to cardiology. Look, how did they... Oh, he's going to ICU. Let me send her to ICU. Cardiology. I wanted to send her there. Where is she? Oh, she's in that resus bed. Okay, there was a tick there. Let me do it. Let me move her now. Internal rage in chat for everyone. Hit those internal rage in chat to satiate my internal rage. Great, Robert Jones is collapsing now too. Can they like treat people? I really hate how I can't change the department. I wonder why you can't. There you watch, they're gonna automatically transfer her once they're done. Holy cow, this is like the third time this guy's done oxygen therapy. Oh, there. See, they automatically transferred her. She's having a cardiac arrest after a myocardial infarction. This person got CHF. See how easy it is when she doesn't have... There it is. Thank you very much, Seraph Blades. There's the internal rage. See how easy it is when they're not collapsing? You can just transfer them and get the treatment slated. Whoa, this person who was collapsing is having esophageal varices. Wait. No, that wasn't her. But she can have band ligation. Holy cow, she's collapsing again? Oh, there's no way, man. We can't do this. Oh, code blew her. Not that it does anything. No one ever does the treatment fast enough. Wait. Let me go back to her window. The doctor is where? The doctor is with her. Okay, good. Well, I mean, they're doing another defib. Thanks, game. How am I meant to treat her fast enough? That's so hard. You can differentiate IHD with heart failure and myocardial infarction by a neck palpation and find out what their JVP is. If the JVP is up, it's probably a heart failure. Oh, cool. Robert Jones. That's his third one. Okay, that we're gone. No. Reload. I'm reloading. That was such an unfair event. Like, they were all collapsing from the go. The first person hit the resus bed and collapsed. No, I'm not resetting. Three out of 5. I've been doing this for like 2 years. Not starting again. Man, stock market crashes are no good as a natural disaster. They're all whinging about their long wait for examination. Dude, give him his nitrates, for crying out loud. Treat the problem. Don't just defibrillate him and then walk away. Treat the guy. Start a GTN infusion. You're ICU, for crying out loud. Cool, and another myocardial infarction. Just go to cardiology. Ah! Oh my goodness, there it is. No. Alright guys, welcome back for some more Project Hospital. Today we're going to do a natural disaster and pretend that last 40 minutes never happened. Oh, it's still a crash on the stock exchange. Oh, is it always going to be the same? Well, at least it's daytime now. Earlier in the day, doing it at nighttime was a bad idea. I mean, it's still a bad idea. Because it's still going into the night shift. Wait, where was that guy who needed exocrine insufficiency? It's Groundhog Day. Let's see if we can do a better job with him. Buy the staff member for ED. Maybe make a bigger ED. I really want to make a bigger room than this. I want 2 more staff. How do I do that? Or maybe just make an extra one? Do you reckon I can take this radiology space and use it for ED? Or should I just make this room I'm going to make this room a staff room. Like a doctor's, what is it called? A on-call room. Whoa, we can have 4 more doctors in there. Woot! Oh no, there's no space for the... There's no space for the chair. Does that work? Seraph Blade says it was a full moon last night. Yeah, it was insane. Did you see it? I had a really bad night. And the walls. The walls need to be white on top and wood on the bottom. That look right? Yep. Now staff. Let's just go overboard with staff. Why can't I put staff in there? Missing staff. Yeah, I'm aware. Oh, chairs. Do they really need printers on these computers? No idea. But there you go. Oh, I know one here. Alright, so 2 staff here. Does anyone like night shift? Is there a night owl? Oh, there's a early bird, a daytime doctor. He can go on the other side. Long drive can be late for work. Okay, put her on the night shift. Get the early bird dude. Where is he? Here? This guy? Go there. And then another one. We don't need this many doctors. I'm not filling up all the office space. Just one more. Oh, that's another day shift person. What's this? Moves faster? Awesome. Put you on night. Alright. Where is the patient with exocrine and pancreatic insufficiency? This one? No, this one. No, not this one. What was wrong with him? I think he needed a CT or something. And an MRI and an X-ray. You know what? I lost him before. I'm just going to order it all now so I don't have to worry about it later. Discharge. Seraph Blades, I meant in game. Yeah, no, it's not a full. It wasn't a full moon last night in real life. Just in game, you are correct. $50,000. Thank you. Asbestosis. How do you treat asbestosis? With oxygenotherapy, which they already did. Good, good, good. There's someone with a cardiac blunt injury that needs a fast. An E-fast. Which is an echo and a fast. But they're separate things in this game. There's your rice bonus points. It's Groundhog Day, except you can't have 2 lots of bonus points, sorry. So much to do. Come on, guys. I have so many internal emergency staff now. They should be able to do this. Who's she going to get? This person is not a code blue anymore. Oh, there is so much movement happening in this cardiology. Well, that's right. There was patients who didn't get all their treatment done over here. You guys are meant to remember which spot they were in so that I can... Oh, that was the hand tremor that didn't need beta blockers. The one I disagreed with. Chylothorax. Physical exam didn't work. Okay, let's do a cardiac investigation. Neck palpation, blood pressure, thorax. Botulism. Sarah Lopez. Oh, she's got a cluster headache. Never mind. She needs to be admitted for that, for oxygenotherapy. Neurology. Look at the ultimate concentration. No one hiding behind those monitors? Okay, let's go up. Uh-oh, Charles Gonzalez. Oh, this is the exocrine pancreatic insufficiency guy. Stool sample. Oh, yeah, great. What can I do? What can I do? ECG. They're just... Remember, it's Charles Gonzalez. Thorax percussion. Chest pain, breathing problems, blah, blah, blah. He needs an echo. He had an echo? No. He also needs heart monitoring. Let's just move him to cardiology. And do ECG, echo. That all? Yep. Okay, back to wards. I thought I did that. Oh goodness, CO2 poisoning. Clavicle fracture. Sorry. Okay, remembering Charles Gonzalez. Thank you. Good idea. The chat remembers all. Yep, I know. Wait, where are you going? Okay, you're sorted. Diet modification? Yeah. Nothing in this surgical ward. Wow, there's so much surgical space. Probably not enough staff to manage that many surgical patients. Okay, how are we going with the emergency? Jessica Gonzalez was a problem before. She's got a diffuse axonal injury, yeah. Can you have a seat here as well, please? Is she in? Where is she? No. I think I need more transport. I want another nurse on transport. In neurology. Where's the nurses station in neurology? Oh, it's up here. Holy cow, there's not enough space. What is all this junk in the nurses station? Wait, that's the nurses station, right? Yeah. Oh, there's already 2? No, I don't want more than 2. Okay, he's got giant cell arteritis. Seraph Blades, if it wasn't documented, it didn't happen. That is very true. How do I make... Oh my goodness. Cerebral contusion. Oh, CT brain, please. What is this guy having a CT for asbestosis? Oh yeah, chest CT. Wow, he got his MRI before his X-ray. Nice. Nice prioritization of care there, guys. I don't know why I'm so interested in her. She's not part of the disaster. What have I got here? Robert Clark is. What's he doing? Oh. Why can't I do echo? Where is it? Has he had one already? No. Where's echo? Or angio? Okay, fine, I'll do an angio then. There's no echo? Maybe I can't find anything on echo, maybe an ultrasound. Okay, John Walker, he's having a stroke. Go straight to CT brain. And treat with IV TPA in neurology. What? What? Why can't I? It's cardiology? Get out of here. This game's broken. He's having a stroke. There's a brain in the image. There is a neurology department in the game, but they decided that he has to go to cardiology for this. What? Maybe because IV TPA needs... Oh, it need... Okay, like, wait. I want to put him in neurology and send him to ICU. Yeah, because... CCU has a... CCU is kind of ICU for cardiac patients. like birthing unit is ICU for birthing patients, pregnant patients. Oh, this is the exocrine insufficiency guy. I think we're doing better this time, aren't we? How do I treat this? Why is he in a normal ward? I think he should be in HDU, but I don't want to move him. I want him to get stuff done. So I'm just going to leave him for now. Oh, okay, cool. She's not part of the disaster. Okay, can we like do stuff here? Can we also move this person to neurology? ICU. Man, I'm doing too much stuff. My staff is overwhelmed. Well, they need treatment. What can I do? They need all the stuff. Keep the dish big. This looks like a lot to manage. Yeah. This is like super late game. It's so fun. I don't know why it's fun, because this is what I do at work every day. Especially with, what have I got? I don't think I can tell how many patients I have, but there's a lot of patients. No, monitor patient collapsing. I don't know why. Because they have hidden symptoms. Okay, let's do an echo maybe. Why is there no echo? Has she had an angio? Oh, she's already slated for echo. Let's do an angio as well. Lisa Robinson. What? No, don't worry about that. Yeah, your hospital is huge. Oh man, it's crazy. Look at how big the ICU is. This is like 2 ICUs here. So it's not as big as Westmead Hospital yet. They've got 3 ICUs. No, wait, I think they have 4 ICUs in Westmead Hospital. Oh, another stroke. So what we need to do with stroke is neurology ICU. Not cardiology. Fine, cardiology, whatever. Uh-oh, Charles Gonzalez is on his way out again. Groundhog Day is happening all over again. I have cured 54% of my patients. Robert Clark still hasn't been... They still haven't figured out what's wrong with him. Let's make him a code blue. Because he's going to collapse soon. Sure. And then those 3 ambulances haven't arrived yet. Lisa Barkley. Oh, she's the stroke. Okay. So that should happen. I don't know why they're not taking them to ICU. These. Well, they're trying to take them to neurology first, probably. Yep. Okay, well, whatever. They can go to ICU later. There she goes. Oh, there goes Charles Gonzalez. Groundhog Day. Okay, yep. I wonder if I need more staff. Look, I didn't need it. Oh, this space. Oh, you know what I should do? I should convert this to the emergency doctor's office instead of this room. No, never mind. I've got enough space now. But I could make extra emergency room space here if I ever got full, which I don't. So I still don't know what to do with this room. We have 1, 2, 3, 4, 5, 6 resource bays. That's how many is in my hospital. Oh, another stroke. Wow. Yep, rip Charles. Sorry, Charles. I tried. Maybe on the next round if we fail this one again. Okay, this guy needs to go to surgical admission laparoscopic surgery for his appendicitis. What do we got here? Joint immobility. Let's do an x-ray of what? Lower limb or shoulder? Lower limb. No, no. Oh, Judy Garcia. Yeah, because she needs a CT brain, guys. I still don't know why they CT all these people who are not code blues before the code blue. Is it going to be a migraine or a stroke? She's got a bleed. This person has a bleed. They need to CT her. Now. Oh, thank you. And then she needs to go to theatre, and they're not going to do that straight away. Like, I want them to go, look at CT. How do I tell them? Look at the CT, find out there's a bleed, take her straight from CT to theatre and do the operation. That's what she needs. That's the only way that she's going to survive. And you can't even do that in real life. You could do that from emergency. You take them straight to theatre from CT. But you can't even do that in emergency in this game. It's impossible to do this, to treat these people, because they take too long. There's steps that you could cut out to reduce the time between... Oh, what? No, that was a different objective. I thought I did it then. She's coming, right? Where is she? Where did they take her to? Oh man, they took... Oh, can they please do something with Robert Clark? He's another one who's going to collapse because then... Oh, what are they doing here? They haven't even fully assessed this guy. They just shoved him in a water and forgot about him. Or did he just arrive? Maybe I should stop putting all the jobs and just do the important job for now. We're not up to the disaster we were on before where everyone was collapsing. But we are struggling to get the diagnosis on these last three. Oh, this guy got his diagnosis. Woo! Now, can we get theatre happening overnight? Is that theatre working overnight in cardiology? Oh, Judy Garcia needs her CT. Oh, right, yeah. They're just transferring her from the ward to ICU. But they need to transfer to CT. What did Robert Clark have? An echo. Seraph Blade says it's a shame you can't manually prioritize them, but then you shouldn't have to do everything. Well, I can manually prioritize. I can prioritize them, but I have to wait for them to do it. And I don't understand why sometimes theatre is not working overnight. I fully have all the teams available at night shift. I guess it's because there's not enough for them. They're all getting stuck doing other jobs maybe. But when I prioritize, so the real thing that is not working for me is if I have someone on a code blue and there's 5 CTs to be done, the code blue should be done first, but it doesn't get done first. They wait for all the others to get done. That was what the problem with Judy Garcia was on the last run. There was like 3 people having a CT before her. I mean, they're still doing it. She's a code blue. She's waiting for a CT. I know there's a bleed here. That's why she's collapsing and having comas. But they not doing her CT first. Look at this dude. He's having a CT. He's not a code blue. He's got a concussion. But he's not a code blue, so he should not be in CT right now. The CT nurse should say, oh, he'll have to wait in the waiting room. We've got someone coming from ICU that needs a CT first. And if I was the hospital manager, I'd be in ICU saying, I'm taking this lady to CT. Is anyone coming with me? Push everyone else out of the way so that she can get her CT done because there's a bleed there and she needs to go to theatre. And then go straight from CT to theatre. Sorry, I'm standing on my soapbox. This is probably what the after hours managers feel like when all the nurses in the water like standing around not sure what to do. And they get there and they're like, oh my goodness, why is nothing happening? This patient should be your priority. Seraph Blade says there's no disaster after the disaster this time. Doing better. Ooh. Oh, there's 2. Who got done? Was it Judy Garcia? So there was only 2 left. Okay. Yeah, sure. 2 cardiology patients that are like, he needs an ACE inhibitor. That's all he needs, guys. Just give it to him. And then Robert Clark. needs cardiovascular surgery. That is a problem. Because I feel like the cardiac team, surgical team is not going to do their job overnight. Look, the lights are off and nobody's home. And then if I go check, this is cardiology. Ready? This is cardiology. There's a medical surgery nurse. There's 2 medical surgery nurses. There's a surgeon. There's an assisted surgery. There's 2 assisted surgery. There's 3 assisted surgery. Oh, maybe there's not enough surgeons. Hang on a sec. So there's 1 surgeon here. Isn't there a cardiology staffing upstairs? Yeah, there's another surgeon here. Oh, he's on a day shift. Let's put another surgeon on then. Have a surgeon? Have a surgeon? No. What about this one? Surgeon? Who's good here for surgery? 482. Let's take David Jones, the fellow. Yeah, fellows can do surgery on their own. Here he is. Go, David. Let's get this surgery happening. What if I go to the patient and see Patricia Thomas? Patricia Thomas does not have surgery. So what if I go to this patient? Go away. Robert Clark. And I change this to Frank Davis. And I change it to Frank Davis. Does that mean he's going to get the surgery? Oh no. Kate Gonzalez is not going well. She needs pericardiocentesis in theater. And what's Joseph Rodriguez? He's not a surgeon. What was the name of my surgeon that I just hired? It is David Jones. Let's change that person to David Jones. Oh no, David Jones is doing Robert Clark. Okay, where's the other surgeon? Frank Davis is the other surgeon. Let's make Kate Gonzalez go to Frank Davis. Oh, you're joking. So we can't make them go to Frank Davis because she's in ICU. So we have to wait until they've stabilized her. Oh, no, never mind. Seraph Blade says, I was thinking this sounds exactly what the Adon would be doing. Poor Adon. No one appreciates them. Because they just come around and make your life really annoying. By saying, what's going on? What's going on? Why aren't you doing stuff? Oh, see, long wait for transport? I hope he's waiting for transport to theatre. I don't think so though, because there's no lights here, there's no nurses here. What does it say? Is there enough free nurses? Okay, I'll get more nurses then. Can I fit another nurse thing in here? Nope. Oh, maybe here. Where's the desk plant? Just a cactus? Oh, there's already a cactus in there. Oh, well, there's two now. Now I need to make this into a wall mounted. That's what I want. Staffing. Night shift. Yep. And can be late for work. Can be late for work. Does not take break. Rest levels decrease slower and faster. Rest levels decrease faster and rest levels decrease slower. Okay. So that means normal. Yes, we did it! You were able to complete this event in time. You gained a prestige boost for this day and a money reward. Congratulations! $20,000. Seraph Blade says probably a different experience in OT, but it's good getting to chat to them about what's happening around the hospital. I just don't like it when they wake me up at 3 a.m. Yeah. From that end, you probably appreciate them more than what the clinical nurses do, because they work hard to make space for your patients. Although, from a theatre perspective, they're probably not appreciated as much because they allow patients to stay in recovery longer than what the recovery nurses would like. But I think operating theatre is pretty well protected from the rest of the drama that's going on in the hospital. There's probably patients in recovery that are like, they should be in the ward by now. Why are they still here? Okay, everyone check. What are we going to do next? We have one more disaster to do. Are we going to do an accident, an epidemic, or a natural disaster? And I'm saving the game. Because I'm not doing that again. Let's just clear these. And then we have to do this impossible have no untreated patients for 4 days next time. We might just move on to the next DLC. I think I'm done. Apart from that no untreated thing, and hang on a sec. Jordan Barkley needs a physical exam. So if we go to insurance, then we've done cheapo care, we've done liver TY. Uninsured is just going to keep going. We need to get to 100. That's just quick snap care is what we're finishing now. And Oopsie Corp's done, and this one's really hard. So that's it. Once we've done, I'm assuming... Oh, physical exam didn't do anything. So remember, CRP is an infective marker. So I'm assuming this is the last quick snap care. Yeah, it is 10 of 11, I think. Oh, it's the last uninsured as well. So, yeah, we just need to move on to the next DLC. Maybe I should buy it.
Head to the go-go, baby!
Whoa! Seraph Blades has redeemed suggested dish for the cooking live stream. I already added the two that you asked for. Is it a different one or is it the same one? Were you waiting to save up your... Can we do that more than once? Yeah, you can. It'll come down to a dice roll when we get to it, if there's more than one suggestion. And then I guess I'll just keep the list of suggestions for a future. Uh-oh, Judy Garcia, who's from the disaster, is collapsing. That's because they won't do her CT brain. Bronchitis. All right, yeah, just undo that. If you did her CT brain, guys, she would have survived. That's going to be a SAC 1 investigation. Alright, Seraph Blades has spent 750 channel points to add lasagna to the list of... so at the moment we've got lamb shanks, lechon, and lasagne. So at the moment it's a D3 roll. You have a 33.3% chance to get your suggestion through. Anyone can spend the points. Also, don't forget that you can put in some points into the community goal pot to try and get me to wear a suit while I do this cooking live stream. Look, she's still bleeding out. But they're finally taking her to theatre. And we're going to be like, oh, what a surprise. She's got to bleed. Take her straight from CT to operating theatre. That's what you need to do. What? What is blunt splenic rupture? What, did he just arrive? Oh, okay. I was like, why is there a blunt splenic rupture being pushed around the hospital? Okay, guys, if you don't want to choose... If you don't want to choose a disaster or an epidemic or a natural or a accident, I'm going to pick. We're going to do a D3. Seraph Blade says, how do you add to the pot? Did I not start the community goal? Hang on. Community challenge, yeah, it's there. You can crowdfund big rewards with channel points. So yeah, it's a 25,000 points to make me dress up in a suit for the cooking live stream. To participate in a Twitch community challenge using channel points, viewers can contribute their points directly through a pop-up panel or a call out at the top of the chat. So there should be a pop-up window or something at the top of the chat. I can't actually see it on mine, I don't think, because I am the streamer. Seraph Blade rolled a 1. Not natural disaster again, maybe accident. Well, do you want to roll a D3 or do you want to do accident? I'll just do accident since you picked it. Breaking news, fans. And you rolled a 1 anyway, which is a disaster, which is a accident. Fans of two football clubs have clashed and the brawl has resulted in a large number of injuries. Significant police presence in the area has allowed responders to treat a large number of patients at the scene, but local hospitals should prepare for an increased number of trauma patients. Alright, there's only 5. We should be able to do this, come on. It's 4 AM. Any walk-ins? I don't think so. With 5, now it's all ambulance. This is it. This is the last one. This is what I thought before when I've lost my save. I realized that I could have been loading the game instead of starting all over again. Save scumming the thing. Save scumming my way through the disaster. Wait, where's she running to? Why is she running? There should be no code blues up here. Oh, this guy is not a code blue. She is getting that guy. What is he going for? Angio. And he's had cardiovascular surgery. The only one that should be a code blue is that lady who's having a CT brain. So no, Linda Brown's not a code blue anymore. I should also put her into ICU if she's not already. Oh, Rachel Baker's not a code blue. Code blue knee dislocation. Nice. That would mean that it had no pulse. A limb-threatening injury. Oh, this one's not a code blue anymore. Blunt pancreas laceration. Blunt pancreas laceration? Going to HTU? Okay. Sounds like an ICU patient to me, but no worries. Where's the one that had a CT brain? Oh no, she's not here. What was her name? Is that the one that we were remembering? Charles Gonzalez, nope. Garcia? Was she Garcia? She was in ICU, wasn't? Is she in theatre? Yep, there she is, Judy Garcia. The CT did show an intracranial hemorrhage. See? I was right. I knew it. She's had 3 comas. Who knows if she's going to survive. They took too long to figure it out. Oh, the diffuse axonal injury. Oh, she's waiting for a CT brain now. Quick, code blue her. Appendicitis? Code blue. Uncode blue Judy Garcia. Nope. Give me the patient. Holy cow. Oh, here, I can click her through here. Okay. She's going to have to go to neurology. Oops. Oh, no. I thought that I had been missing chat, but no, I'm good. So far, so good. What's this guy? Migraine? Awesome. Vomiting and pain is a migraine, apparently. Yep, there you go, neurology. It's probably going to end up being blepharitis, which needs a culture. What did we get? Blurred vision, pain, thirst, weakness, vomiting. Okay, John Green, he's got a deep wound on his foot. Oh, we've also got a simple fractured femur. Oh dear. Oh, it doesn't need surgery. Okay. Do you reckon I should do an x-ray? Or just treat what I know? Yes, x-ray. Okay, we've got 3 of the patients, 2 more coming. Oh. Okay, giant cell arteritis. CRP. CRP is good. CRP rules out a lot. Oh man, they transferred him to ortho already. I was hoping they'd do the stuff before they transferred him. CRP didn't rule out anything. Awesome. Ophthalmoscopy. Physical exam, chest auscultation for lupus. Thorax percussion. I like thorax percussion. Speech listening. Interview, urine serologic evaluation. Blood test, ECG. Physical exam, physical exam, physical exam, physical exam, physical exam. Neck palpation. Physical exam, physical exam, physical exam. Wow, it's nearly 11 o'clock. I gotta go to work soon. Okay, let's see how they go with that. Carol Wright is waiting. No free bed in HDU? Oh, why not? Wow, the surgical HDU is so full. Liver contusion? Fistula? No. Peritonitis? No. Renal contusion? Maybe. Blind panga, this one. This one should be in ICU. She can also go to ICU. Did I already prioritize? Oh, I don't want to prioritize her because she's just a normal patient. Wow. Ophthalmoscopy was the ticket that time. Alright, it's just Jessica Lewis left who just arrived. Come on. It has been a long time coming, this event completion. And it's a leg injury. With a bruise. Appendicitis. Joseph Gonzalez just had the surgery for appendicitis. Oh, they do use the stretchers in the theater room. I like it. I didn't know they did that. Ah! This sounds like a fracture, bruise, chest injury, swelling, pain. Sounds like more than just a contusion. Diffuse axonal injury went for an MRI before CT. Nice. She's gonna have a bleed. Why is there so many ambulances rushing out? Oh, they're X-ray. Is this her? Oh wow, she's already in X-ray. Sometimes it works so efficiently. Seraph Blade says, almost there, you can almost taste the victory. Thank you very much for the hydrate. You could see Stitch's mouth coming up there. Nice. I want to see Jessica Gonzalez and whether she has a bleed. There it is. She's got a simple fractured tibia. That's just a leg cast, everyone. Peter Davis has finished their investigation. Physical exam, lungs. Maybe thorax percussion, although that's more of a cardiac thing, isn't it? Let's just go with that. Or a pneumothorax, I guess, chest percussion. I don't think that you can get pneumothorax from thorax percussion in this game. You would also do neck palpation to find out about a tension pneumothorax. Anything? Not done yet? No, it's done. MRI did show a headache. Really? Or did it just show diffuse axonal injury? Alright, well, she doesn't have a bleed. There you go, guys. I was wrong on that one. Wow, X-ray is getting busy. Why is she running? She's not even a... She's not even a code blue. But they're doing it maybe because she's still a trauma? Oh, because they're running to do TC hospitalization. Not enough stretchers in ICU? There we go. Woohoo! They got that leg cast on. Brooke Cole's waiting for has finished interview. Oh no. She needs ophthalmoscopy. You were able to complete the event in time. You get a prestige bonus, $20,000. Whoa! Hang on, it's coming. Well, really? Thorax percussion showed pneumonia. Nice. So he needs admission. Hang on. Hang on. Let me get excited in a second. IV antibiotics. There we go. Objective complete. Successfully finished 5 events in a row. Yeah. Prestige bonus 20% addition for 1 day. Wow. You don't know. That took so long. I should have gone back to check like I did with the Icarus mission that took so long. But I have been trying to do that for so long. Oh, there's more. We have to do 10 events in a row now. Oh, we're just going to... Oh, but you have to start from 0. Oh, wow. Okay. That's another 2 years worth of content right there. Thank you very much for joining us, Seraph Blades and Kip the Dish Pig. If you enjoyed it, don't forget to like, subscribe, follow. If you're watching this after the stream, make sure you head to the YouTube channel to put your comments there so that I can reply to your comments. And Seraph Blades says, but wait, there's more. I thought that was the last one. Is this objective 11 of 11? Was that 10 of 11? Get $300,000 when we do 10 events in a row? Wow. All right. Thank you for joining me. And we'll catch you in the next one. Bye for now. I have to go to work. Oh, and Chubby Kim. Yeah, thank you very much, Seraph Blades. Thanks for dropping in, Chubby Kim. Where was your message? Oh, did I lose the start? Oh, I lost the start of the chat. Okay, never mind. Thank you. Bye.